poison. Okay, so somebody tell me the classification of corrosive poison. Anybody can tell me the classification? What is the classification of corrosive poison? Be sure. Huh? Corrosive poison for classification. What is the classification? So corrosive poison is classified into 3 types. So the first one is strong acid, second is strong alkali, and then next one is metallic salt. And this strong acid is for the classified into inorganic and then organic. So on today's topic, we'll discuss only inorganic corrosive poison, okay? So corrosive poisons are chemical that will erode and destroy tissue that comes in contact tissue. And the extent and severity of the injury due to corrosive poison depends on 3 factors. So the first one is nature of the chemicals, second one is its concentration, and the third one is duration of contact. So these are the 3 factors. Next one is very important, mechanism of action of corrosive poison. So when corrosive poisons come in contact with the tissue, it will cause extraction of the water, and that will lead to the rapid dehydration of the tissue. So that is the first mechanism, okay? Extraction of water from the tissue. And the second one is similarly large amount of heat necrosis. So remember these 2 difference in the case of acid and in case of alkali. And the third one is it will convert hemoglobin into hematine. So these are the 3 mechanisms of action: extraction, production of large amount of heat, and then conversion of hemoglobin into hematine. So these are the example of inorganic corrosive acid. So sulfuric acid, nitric acid, and then hydrochloric acid. Sulfuric acid, or this is also called oil of vitriol. Okay, so physical properties of sulfuric acid: it is colorless, hygroscopic oily liquid, and non-fuming in nature, and mostly used in manufacturing of battery and fertilizer. That is the use of sulfuric acid. And the fatal dose is 5 to 10 ml, and the fatal period is 18 to 24 hours. Symptom that is seen in case of sulfuric acid poisoning. So the first one is there is presence of burning pain in the oral cavity and gastrointestinal tract. Okay, and the second one is vomiting. In color. Okay, and the next one, lip appears swollen and brown or black streak may be seen from the angle of the mouth or on the chin area. So when you look at the angle of the mouth or on the chin area, you will see brown or black streak. Tongue appears swollen with white coating. Initially you will see swollen and there is white coating, and later on that will become darker or brown in color, corroded and shapeless mass. That means the margin is ill-defined in later phase. Here the appearance of the tongue, there's inflammation, redness you can see, and then white coating. Okay, chest you can see the blackish and brown color. So these are the changes you will see in case of sulfuric acid poisoning. Teeth, chalky white in nature, and there is presence of intense thirst, but the person is unable to drink any water. because the drinking will cause vomiting. Voice, nature of the voice, hoarse and rough. That is due to the inflammation or edema of the larynx. And the next one is hypersalivation, can be seen after 2 or 3rd day of the ingestion of the sulfuric acid. To the stomach, it will cause perforation of the stomach. That is the another cause of death. And the third one is due to the shock or septic shock. And that one is the third one, cause of death in case of sulfuric acid. The treatment or the management, how to do the management or treatment. So the first one is supportive treatment. So you can give oxygen and then keep the person or the patient in ventilator support. So if the skin has come in contact with the sulfuric acid, then you should do the cleaning of the skin area, contact area, and then you can apply magnesium oxide ointment on the burn area. And in case of edema of the glottis, we should do tracheostomy. Okay. And if eye has come in contact with the acid, then you should do washing of the eye using plain running water. And gastric lavage and emetic should not be done. It is contraindicated because it will lead to perforation. Okay. And the next one is you can give mechanical antidote. If you are seeing the patient within 30 minutes of the ingestion of the sulfuric acid, then you can give mechanical antidote. And patient should be kept in NPO. Everybody knows NPO, nil per oral. Okay. And IV fluids and nutrition should be given to keep the patients hydrated and to correct electrolyte imbalance. And in case of perforation and peritonitis, you should do urgent laparatomy. So the treatment is only symptomatic in case of sulfuric acid. Postmortem finding. So the external finding. So mouth, lips and skin appear brownish black in color, which is corroded in nature. Okay, that is the only external finding you will see. And the internal finding, stomach and its content appear dark brown or black in color, and it is contracted. The mucosa of the stomach is contracted. Mucosa of the stomach, you will see the underlining of the mucosa red or inflamed in nature. Okay, and the lesser curvature of the stomach is more affected when you compare with the greater curvature of the stomach. So whenever you do the dissection of the stomach, always you have to do from the greater curvature of the stomach. Okay, to preserve the injury on the lesser curvature area. Next one is nitric acid, or this is also called aqua fortis. So it is a clear colorless liquid and it produces fumes and has peculiar choking odor. So that is the feature of the fatal dose is 5 to 15 ml and the period is 12 to 24 hours. Now the symptoms. Lips, tongue, mucous membrane of the mouth will appear soft and white in the beginning, and later on it will turn into yellowish in color, and that is due to the formation of xanthopoietic acid. So when nitric acid comes in contact with the tissue, there will be the formation of picric acid, and that formation of the picric acid will produce yellowish color, and that is called xanthopoietic reaction. That is one of the specific feature you will see in nitric acid. And cloth. same yellow in color. Vomit also yellowish. Abdomen will appear distended and tenderness. Okay, and in inhalation form of the nitric acid, you will see symptoms such as lacrimation, coughing, sneezing, shortness of breath, irritation of airway, and then patient also complained of dry throat. So cause of death. So in ingested form, the cause of death will be suffocation, same as that of the corrosive sulfuric acid. So suffocation, and then there will be perforation of the stomach, and then shock. Whereas in the case of inhalation form, the cause of death will be suffocation, and then later on, the cause of death will be due to pulmonary edema, bronchopneumonia, or pulmonary fibrosis. Okay, so the cause of death in case of inhalation and ingestion are different. Postmortem appearance, external finding. So skin and mucous membrane appear yellowish in color. That is the external finding. And the internal finding, stomach, mucus of the one is hydrochloric acid. So it is colorless, fuming in nature, and produce pungent odor. And it is also known as muriatic acid or spirit of salts. So the fatal dose is 15 to 20 ml, and the fatal period is 18 to 30 hours. When we compare hydrochloric acid with nitric acid and sulfuric acid, it is less reactive, and then it will produce mild symptoms. Okay. So the symptoms seen are skin and mucous membrane will appear gray or grayish white in nature earlier in the beginning, and later on it will turn into brown and then into black. In case of inhalation form, there will be irritation of the airway tract. And symptoms include such as complaints of coughing, short of breath, and the dry throat, dry cough, etc. And there is also a spasm of glottis. And chronic exposure to hydrochloric acid will cause symptoms such as conjunctivitis, cornea ulcer, bronchitis, pharyngitis, inflammation of the gums, and loosening of the teeth. And this chronic exposure is mostly seen on occupational worker. Okay, who are constantly exposed to the hydrochloric acid. Okay, so today this much, and on next class we will discuss on the inorganic corrosive poison.